Right, well, the Health Minister, Dr. Joe Phaahla, says that the department is very concerned about vaccine hesitancy and anti-vaccination and fake news campaigners. Phaahla and other senior officials from the department yesterday appeared before Parliament's Health Portfolio Committee to provide an update on the COVID-19 vaccine acquisition and rollout program. Let's discuss this further. We're now joined via Zoom by epidemiologist Dr. Joe Barnes from Stellenbosch University, as well as Dr. Angelique Coetzee, who's the Chairperson of the South African Medical Association. A very good afternoon to you both, and thank you so very much for being with us here on SABC News this afternoon.
Good afternoon, and good afternoon to the viewers.
Let me start with you, Dr. Angelique Coetzee. How big is this problem of vaccine hesitancy? I mean, if one were to rely on imagery on social media, for example, one would think we don't really have that much of a problem with vaccine hesitancy, as you see people, taking pictures at vaccine sites, sort of promoting getting vaccinated. But I guess, of course, social media doesn't necessarily paint a full picture of what's really going on in the country. But let's talk to that. How big is this problem of hesitancy?
Good afternoon, and a good afternoon to all the viewers out there and everyone. There was some of the papers that has been released doesn't show that hesitancy is that big a problem. Around about between 60 to 70% of people indicated that they will go for a jab. There's still some questions that they would like to have to be answered, but overall, it is not the majority of people. It is normally, if we look at, as I say, about the papers that has been released around about this problem, it's really not. It's less than 1/3 of the population that are not keen. And then, as I have said, it's not that they are that hesitant. It is they still have some questions. If we can answer those questions, I think we will win them over.
Yeah. And speaking of that, Dr. Barnes, let me bring you in here. Some people have, been labeled anti-vaxxers, and they might have, genuine fears and questions, as Dr. Coetzee puts it, about vaccines, and perhaps the labeling of them makes them even more hesitant than they would have been about asking those pertinent questions, because those questions are sometimes labeled as being stupid. Just get the vaccine, don't ask those questions. Surely it is important then to start to have these dialogues and conversations and not dismiss people as just being anti-vaxxers. And some of these people have even rightly said, look, I'm not an anti-vaxxer. I was vaccinated as a child. I've continued to vaccinate my children, but I have certain questions about these particular vaccines, these COVID-19 vaccines. So how do we address this, and how do we move on and start to have these conversations and dialogues?
One needs to be very clear about the difference between what I would call hardcore anti-vaxxers, who are absolutely under or in no way willing to change their stance on, and they would rather die than lose face or admit that they made a statement earlier that turns out to be wrong. So those hardcore anti-vaxxers will not change, and they are highly unlikely to be a very large number of people, just as Dr. Coetzee had said. But the vaccine hesitant people, it's defined as a delay in acceptance of the vaccine, even when the vaccine is available. And it's a complex set of reasons that people have, and they have legitimate reasons for that. First of all, there are cultural reasons for some people. There are psychological reasons that some people don't trust easily. There are political interference in some countries, as shown that, particularly, for instance, in the USA. And then there are lack of knowledge. So all of these various drivers need to be addressed in different ways. So I'm really worried that there's been a clear link shown overseas in some groups that people who do not trust the government, their government of the day, or certain groups of the government, are also more likely to not trust the message coming from the government to vaccinate. So we will have to be a lot more sophisticated in our vaccine education campaigns and rollout campaigns than we are at the moment.
Yeah. Let's carry on from there, Dr. Coetzee. I mean, I was looking actually at a medical report, I think it's from the US, in fact, which says that, vaccine hesitancy is specific to subgroups within populations and that it's rarely population-wide. Is that accurate? And if so, who are these subgroups? Are they easily identifiable as to who would necessarily, Dr. Barnes talks about those who don't necessarily trust their governments, who would not then be trusting the message coming from the government. But can we perhaps zoom in into who are these subgroups that, are being spoken about?
So what we have seen on some of these studies was that the majority, but now again, this is South African data, so I can give you an answer on the South African data, that the reasons why people are hesitant is the side effects. They don't know, they still feel they haven't had enough information around side effects. That can be a younger generation group, it can be an older generation group. It doesn't matter who you are. If you are not sure about side effects, it will make you hesitant. They also have queries around how effective is these vaccines. And then the third thing was distrust. So if we look again at these three reasons, I think it was a doctor that just now said that we need to make sure that the people understand the side effects. And it's easy for us to say, that's not a real side effect, it's fine, just take a painkiller. But in the end of the day, for that patient, it is a real side effect. His neighbor is seeing the side effect, or his brother or sister. And then they say, no. Let me first wait now and see what's going to happen to the person that I know that's been vaccinated. So there's not enough information going out on the level of side effects. The ineffectiveness, people, I'm always saying people do read. Whether they read the right stuff or not, it doesn't matter. The fact is they read. And they will say to you, but why do I still need to wear my mask? Why do I still need to get a vaccine even after I have been had COVID? Why did I get COVID even though I've been vaccinated? It's all those type of questions that we need to address at the right level, and then trust. I'm sorry, if they don't trust, doesn't matter which group you belong to. It's a problem.
Dr. Coetzee, I think that I want to bring you in there. Some important point just raised there by Dr. Barnes in terms of some of the questions that people may have, and this has been quite a big one that I've also noticed, where people are questioning whether it is the efficacy of the vaccine first of all, and also wondering about the side effects. But then on the back of that, there was a question, and I saw recently what the people that are being termed anti-vaxxers in South Africa, and I don't like to use that term, but they were protesting outside a hospital recently, and one of the anti-vaxxers said something like, if it was that effective, then why are we hearing that we're going to continue to need booster injections, that we're going to have to keep going in every couple of months to get booster shots? Does that not indicate that this is not effective? And I think it's important to discuss and answer those sort of questions. I mean, what would you say to that? And I think, let me start with you, Dr. Coetzee, but I'll also, in fact, ask you to answer the same question, Dr. Barnes. Dr. Coetzee, let's start with you.
So this is why it is so important to get the message out there correctly and give them the correct stats. So I know that National Department of Health is going to release a program where they, on a daily basis, they will say this was the adverse reactions that has been reported on the system. This is how many people died that has been proven with COVID-19 or because of COVID-19. So if one can get that and show them. And then if you can show the people the stats, today I heard very good stats from ProfMed Medical Scheme, where they showed that the people who had been vaccinated, the hospital admission rate for that group vaccinated versus the non-vaccinated group, actually only 7 people in the in the vaccinated group that was once vaccinated. So, we can assume that maybe most of them was Johnson & Johnson, and that's the one vaccination. Their ICU admission rate was around about 7. People not vaccinated was in over 200. So if you start to look at the stats, and that's real data, Discovery also have some of those data. So if we can get that data out there to show the average person out why it is important, even though you still need to wear your mask, but your chances of getting in hospital and be severely ill are greatly diminished if you take your vaccines. We cannot guarantee you that you will never get sick. We cannot guarantee you that you will never die. But we can guarantee you that's less.
Dr. Barnes, please, if you can give us, an answer to that very same question. Unfortunately, we are running out of time at this point, but I'd really like you to add your voice to that question too, about, the side effects, the effectiveness, and this issue that's been quite a sticky issue in terms of these booster shots that people are being told they'll essentially have to keep taking.
There has been a misunderstanding in many of the general public's mind that a vaccination against COVID-19 will work like vaccine against polio. You get a shot and then you would never ever get it again, and you're free of that. We are still in the early stages of developing this vaccine. We're not yet at that point. And so perhaps there has been a wrong sales pitch in the beginning, or a misunderstanding that wasn't corrected. The vaccines we've got at the moment will prevent you from getting seriously ill, and in most cases, by far most cases, prevent you from having to go to hospital or into ICU or even dying. So if the small, very small side effects that you would get from getting the vaccine pales into insignificance versus the crisis that is caused by getting the disease itself.
All right, Dr. Joe Barnes, epidemiologist from Stellenbosch University, and Dr. Angelique Coetzee, Chairperson of the South African Medical Association. I appreciate your time, both of you, and thank you so very much for weighing in on this. Very important that we have and continue to have these kinds of vaccination and kind of air out some of the issues that people might be having that are stopping them from indeed getting the vaccinations. I appreciate your input this afternoon. Thank you.